Okay, I think we'll go ahead and get started. We want to say good afternoon to everyone and thank you for joining us for this month's Learning Community for Family Leaders. We hope that you will find today's presentation informative and useful. Today we are going to be covering transition planning, the important role of families or youth and young adults with behavioral health needs. And feel free, if folks want to type into the chat box just to say hello and tell us where you're from, that's great. So the Learning Community for Family Leaders is hosted by FREDLA, the Family-Run Executive Directors Leadership Association, and we're a partner in the National TA Network for Children's Behavioral Health, operated by and coordinated through the University of Maryland. And the Learning Community is an opportunity for us to bring you information about key topic areas from your peers in the field, as well as engage in a dialogue with all of you about what else is happening across the country in these key topic areas. So we hope you will take advantage of the opportunity at the conclusion of today's presentation to ask the presenters questions and to share with us information about the work that you're doing around transition-aged youth and transitional programming for youth and young adults with behavioral health needs. Today we're going to have myself, Melissa Pearson, and I am the project coordinator with the Family-Run Executive Directors Leadership Association, or FREDLA. And then we have two other presenters that you'll be hearing from, Lisa Lambert, who's the Executive Director of Parent Professional Advocacy League in Massachusetts, and Kathleen Abate, who's the former Executive Director of Granite State Federation of Families in New Hampshire. And they can introduce themselves a little bit more formally when we get to that. But want to get started with today's objectives. And we hope that by the end of today's webinar, you'll have an understanding around the following areas: the key principles for working with families of youth and young adults with behavioral health care challenges, how to recognize some of the unique transitions facing youth and young adults with behavioral health care challenges, and how families, family-run organizations, and providers can play a key role in the transition process for youth and young adults with behavioral health care challenges. So our agenda for today, we're going to talk a little bit about why family engagement is important, the principles for transition planning, the role of family-run organizations in transition planning, and then, as I mentioned earlier, we will spend some time at the end doing some Q&A. So let's start today's presentation off with just finding out a little bit about who's on the line with us and who's here today joining us for this learning community. So if you could tell us how you are connected to systems of care work, or who's joining us for today's call, The options are you a parent of a transition-aged youth? Do you belong to a family-run organization? Do you provide transition programming for youth or young adults? Or other? And if you've selected other, if you could tell us in the chat box what your role is, we would appreciate that. So we'll give folks just a few minutes to answer that question. All right, it looks like we have a nice mixture of people today, but it looks like we have about 41% who are providing transition programming and about 44% who are from who've selected other, and some of those are from system of care program managers, clinical program planner, foster care, transitional coordinator, state behavioral health agency, family support coordinator, mentor, for youth. So we have a wide variety of people joining us today, so that's wonderful. Thank you all for being here. The next question we'd like to have you respond to is how often you see transition programs that are tailored to meet the needs of youth and young adults with behavioral health needs. So the options are very often, some of the time, or not very often. So again, we'll give folks just a minute to select their choice. Okay. Well, it looks like about half of you responded that some of the time you see transition programs that are tailored to meet the needs of youth and young adults with behavioral health needs. So but about 36% said not very often. So we hope that today's presentation will give you some strategies and ideas to go back and maybe begin working on some programs that are a little more tailored to this population. So we're going to go ahead and dive right into the presentation right now. We're going to start our discussion today by taking a look at some of the outcomes for the 3 million youth and young adults with mental and behavioral health challenges. Almost half of 18 to 25-year-olds with mental health needs don't receive treatment. More than 15% of them moved more than 3 times in the past year, demonstrating a lack of stable housing. And 19% of young adults 20 to 24 had neither a job or were enrolled in school, demonstrating a lack of employment and educational stability. So as you can see, the data tells us that youth and young adults with behavioral health challenges don't necessarily have the best outcomes. That means for those of us working with youth and young adults with behavioral health needs, we have an opportunity to have an impact in these areas. And one of the ways that we can impact these outcomes for youth and young adults is by effectively engaging family members as partners in the transition planning process. We find too often that families feel left out of the process or are not always immediately thought of as the partners and resources that they could be. Youth and young adults exist in the context of families, not in systems, and so family members are typically some of the most invested people in the youth and young adult's life. That means they can be key in helping us plan with what might work and anticipate possible challenges that we might encounter. Families have access to critical information such as the child's health history, education history, and service system history. For youth who have been in state custody or may have lost contact with family members for a period of time, we need to anticipate that the youth or young adult will likely feel an interest in reconnecting with family. We all inherently feel a need to connect with where we came from. Given this, if possible, it's important to identify potential family members who may be able to participate in planning to ensure this reconnection process is a positive experience for the youth and young adults. Be aware that there are transitions happening not only for the youth and young adults, but also for the family. They've often spent many years being their child's advocate, education expert, insurance representative, and systems navigator. And now their role is about to change to that of mentor, resource, coach, and advisor. To step back and allow their youth and young adult to take the wheel can create some strong emotions and concerns for families. This is why it's important to plan early with both the youth and the family. Both the family and the youth have a valuable role to play in succession planning, especially when working with youth, young adults with behavioral health needs. Failing to include the expertise of the youth, young adult, and family members can lead to unsuccessful transition events. The fallout of an unsuccessful transition event often falls on the shoulders of families, such as raising grandchildren, legal fees for youth involved in law, providing financial and housing support for child who becomes ill. Today's webinar hopes to give you some information about how to engage and prepare families for the transition process of their youth and young adult, how their role will change in the transition process, and strategies for how you can best respond to the unique transition situations that face youth and young adults with behavioral health needs. While reaching the age of 18 is often an exciting time for youth, it can be a very stressful time for family members and those working with transition-age youth because of the difference in eligibility for services, supports, and programming. In the mental health system, many children and youth are able to access services and supports. However, when they turn 18, the eligibility frequently changes. They may no longer qualify for therapy and/or medication clinic services, including the services of a psychiatrist. Graduation can also mean loss of school-based mental health services, vocational training, and other support services. While some youth who have an individualized education plan or IEP may continue to receive educational supports until the age of 26, many of our youth and young adults will not choose to do so. There's a lot of stigma around attending school at 20 or 21 years old while all your same-age peers are going to college or getting jobs. As you begin to think about how to effectively engage parents and caregivers and family members, we want to suggest some key principles we feel are important when working with youth and young adults with mental and behavioral health challenges and their families. Using a family-inclusive approach is key. Providers often enter the youth and family's life in mid-transition, and the need to immediately come in with a family-inclusive approach that values the role families have to play in the treatment and transition process and incorporates the family within their transition work with the youth is critical. It's important to identify and incorporate the family's culture. It's the worker's responsibility to ensure that their work with the youth, young adult, and family member is respectful and inclusive of the youth and family's culture. As you plan for transition, ensure that the youth and family's culture is reflected in your services, supports, and strategies. For example, in some cultures, the young adult needs the family permission before dating. Some religious beliefs may pose issues around sexuality and gender identity. And in some cultures, mental health is seen differently and can be a barrier to accessing services. Value the family's expertise. As I mentioned earlier, the family has often been the primary decision maker for the youth, and it's helped to get the youth to where they are today. Due to that, they have a lot of valuable expertise to offer and important health-related information to share. So be mindful of this expertise, acknowledge it, and help the youth to see it as something of value. Shared access and communication is critical. Ensure that family members are not cut out of the process simply because the youth young adult has reached the age of majority. This is an area that should be explored prior to the youth becoming 18. Determine what level of access and communication makes sense for the family and caregiver to have in the youth and young adults treatment process. Can they communicate with providers? Do they have access to information and records? Be sure youth and young adults know that releases of information will need to exist once they turn 18 in order for providers to be able to speak with their family and caregivers. Individualized and normalized. Youth and young adults do not want to be seen as different. They want to be seen like anyone else. When looking at programming and services, keep these things in mind. Young adults want to work, go to college, have friends, and do the kinds of things their same-age peers are doing. While all youth and young adults are unique, youth with mental and behavioral health needs need an individualized approach to ensure their needs are met. For example, a youth with a mental health diagnosis not only needs a primary care provider, but they may also need a psychiatrist who can manage their psychiatric medication. Transition planning should be approached as a unique, individualized planning process with each youth and family based on their needs, preferences, and culture. It's critical to promote independence. When working with young adults and their families, it's critical that planning incorporate the promotion of independence for the youth. While the journey to independence will be individualized and based on that individual youth and young adults' needs, wants, and preferences, it is important that the youth and young adult experience an expectation that they will succeed, that they can become independent, and that the transition process is a vehicle to achieve this goal. Fostering high expectations for our youth and young adults is especially important for those who experience behavioral health needs. While they may attain skills and accomplishments in a different time frame than others, by fostering high expectations, we teach our young adults societal expectations and demonstrate our confidence in their abilities. We need to ensure support for both the youth and families. Transition can be a difficult process, especially for youth or young adults who have a behavioral health condition. It's important to connect youth and families with a source of support. Often, youth and young adults and family members find it helpful to connect with others who are experiencing similar situations and transition. Family-run organizations, youth programs, and youth-run organizations can be a great place for young adults and families to receive support, education, community involvement opportunities, and peer support services from trained parents and young adults with lived experience. Crisis and safety planning is best whenever possible to try and anticipate any potential crisis that may occur with youth and young adults with behavioral health needs. When a crisis occurs, it is often the family who is first to be contacted for help. Given this, it makes sense for family members and caregivers to be included in the development of the crisis and safety plan. Family members can often anticipate what kinds of issues or triggers or circumstances may bring about a crisis, strategies for responding to a crisis event, and potentially share tips for preventing a crisis before it occurs. It's important that age not be the only variable considered in decision-making. The individualized needs of the young adult are key to determining how decisions will be made and what the process will look like. While the goal is for all young adults to make their own decisions, you need to determine the readiness of the young adult to do so. Some young adults may be able to take the lead on decisions such as whether to seek employment rather than pursue ongoing education, but may need some assistance when it comes to decisions about treatment or their finances. We want to be sure we are setting young adults up to succeed, so it's important to consider what services and supports are available prior to decision making. This includes the readiness of the family member or caregiver to step back and allow the young adult to take the lead in decision making, their willingness to be involved during the transition process, and or their capacity or willingness to provide ongoing support of the young adult. Making mistakes creates a natural learning process for young adults to determine what works and what doesn't. All young adults make mistakes. Youth with mental health needs will be no different. Families have a role to play in helping young adults through their mistakes. Young adults will often look to their families when they find themselves in a tough spot. By having families involved in the planning and helping families to understand that making mistakes is part of the growth and development process, families will be able to respond in a more helpful way. Families have a role to play in supporting their young person as they learn to use their voice, lead the decision-making process, and take on more responsibility for their own treatment, services, and support. While all youth will experience transitions, issues that face all young adults are often compounded when the youth or young adult experiences behavioral health needs. While we recognize the young adult's right to make decisions, we must also recognize the unique issues facing young adults with behavioral health needs. A poor decision on the part of a young person with mental health needs can have catastrophic consequences, and frequently family members and caregivers are the ones who are brought in during a crisis to help stabilize the situation. As we look at treatment decisions, a young person who decides to discontinue their medication or formal services could end up in jail or have significant legal expenses. Nearly 6 million children are being raised by their grandparents, according to a 2005 U.S. Census Bureau survey, many due to the mental illness of a parent who is unable to balance their mental health and the responsibilities of raising a child. And lastly, as mentioned at the beginning of the webinar, almost 19% of young adults with behavioral health needs have no employment, meaning they are either being supported by the family member or caregiver, or sometimes they are engaging in in unhealthy behaviors to support themselves and keep a roof over their head at night. We must understand these unique transitional decisions facing youth and young adults, and that we prepare for them as much as possible. Work in partnership with parents, caregivers, youth, and young adults to anticipate and plan for these transitional decisions and put in safeguards, safety nets, supports, and resources whenever possible, so that in the event a youth or young adult does make a poor choice and the consequences are detrimental, that there's a way for the family to be involved in helping determine what will happen next. This means ensuring there are releases on file, that there is an ability for parents and caregivers to communicate with service providers, and that there is a crisis and safety plan in place that can be activated in the event it is needed. So we'd like to ask one final polling question of folks at this time, and that question is, does your organization, whether you're a family organization or other child-serving system, have dedicated transition planning programs for youth or young adults with behavioral health needs and their families? We'll give folks a minute to register their response. So yes, you do have dedicated transition programs for youth and young adults with behavioral health needs. No, you don't, or you're not yet, but you're currently developing this type of programming. All right. Looks like the majority of folks do have dedicated transition planning programs, so that's wonderful. Thank you for having that, and I'm sure families appreciate that as well. Those kinds of programs are so important to have available for our young people with behavioral health needs and their families. I am now going to pass it over to Lisa Lambert, who is going to talk about her work in Massachusetts. Both of our presenters have led statewide family networks in their states and have done a great deal of work in the area of transition. They are going to share with you today the role a family organization can play in helping engage and sustain family involvement. And first up, as I said, is Lisa Lambert.
And hello, everybody, and thank you, Melissa. Appreciate that. I hope everybody is having a little bit of a warmer day than we are in Massachusetts. We seem to have winter back, but spring is coming. So I wanted to start off by talking about the millennials. These are the people we are talking about. We put together a legal guide a few years ago with some support from our mental health block grant. And we wanted to take a look at who are the young people or the millennials these days. And there's quite a lot of research and quite a lot of data around who they are. There are, I think, about 77 million of them from 18 to their early 30s. They are 1/5 of all the same-sex couples in this country. Many of them say more than half, or about half, say their parents influence how they vote. But the other things to look at is that about 60% of them have financial support from their families, usually from their parents. More than a third are living at home these days. 83% have health insurance because of the provision of young people being able to stay on their parents' health insurance. Usually the health insurance is through a parent's plan, though it can sometimes be through other means. The good news is that 83% of them do have health coverage. Some of them do have jobs, the millennials, though not as much this group that we are talking about. And only about 40% are in college of the millennials. So these are important things for us to think about, because I think a lot of times the norms we have in our mind that young people should be financially independent, they shouldn't be living at home, they should be in a 4-year college or 2-year college program, does not match up with what the rest of their cohort is doing. The rest of their cohort is receiving support and is a lot of times financially intertwined, and also intertwined with their parents around advice and around ultrasound, guidance, and that's pretty much the norm for this group of people. So if we can keep that in mind, it might be a good place to start. From the parent's perspective, nobody gives you a book and says, this is the role that you should be playing. This is how you help steer a young person from their teenage years to complete independence. So parents try to figure it out, and some parents have an instinctual grasp. Some parents have had other people show them the way, but most of us are sort of figuring it out as we go along. We're building the plane while flying it, which is a pretty common experience for parents whose children have mental health needs anyway. If the child has a team, if you're lucky enough to have a team around you and your family, you're going to get a lot of different messages, and you're going to try to figure out, should I pay attention to that? Should I not listen to that until I've done this? And so there's a lot of, what do I want to say, figuring out the priorities, trying to figure out who should have the loudest voice. And I'm sure that's mirrored by our young people as well. The young adults want to do things for themselves. Their natural inclination, of course, is to be independent, and they have privacy concerns. They have privacy concerns about making choices. They have privacy concerns that other people sometimes have told them to pay more attention to. Maybe their educators have said, you don't have to share this now. They've heard it somewhere sometimes. Some other times it's because it's really super important to them. So there's a range sometimes on what their emphasis is around privacy concerns. And there's also a lack of knowledge for parents about what the options are around what their role can be and how to navigate this particular transition. So we sat down here at my organization. Like I said, we were very lucky to get a little bit of money from our mental health block grant to be able to do this. And we decided to create a legal guide for parents because a lot of the questions that came up among parents were not the sort of touchy-feely questions. They were really questions about healthcare and financial decision-making. And we saw that there were books out there for parents whose children had intellectual disabilities, parents whose children had autism, but there really weren't any kind of guides that we could draw upon and show people that were really tailored for parents whose kids had behavioral health needs. So we're fortunate enough in my organization to have a couple of lawyers on the board who were able to do the research, and we were able to then take that legal knowledge and put it into a really accessible format for families. The other thing we wanted to really capture is that the landscape keeps changing. It might change today. There's a vote in Congress, as we all know. But recently, before we had done this guide, the Affordable Care Act had been passed. And as I mentioned, lots and lots of young people were on their parents' health insurance plan. And the ABLE Act, which I'll talk about briefly, had also been reauthorized. So we wanted to capture some of those things to make sure that families were able to touch on those. Next one. So for kids who are in school that turn 18, if they're in high school, a lot of different things happen, and it happens quite differently state to state. In New York, I believe the default for a young person who is still in public high school and 18 is the parents continued to be involved. They continued to be invited, to the special education team meetings. In other states, that's not true. The young person has to fill out forms. So there's a wide variety of ways in which parents are automatically included or automatically not included. Many public school systems will, when the student is still 18, restrict the parent's access to records, and people need to be aware of that by hopefully before the student turns 18, filling out forms that allow the parent to continue to see what's in the IEP, what the testing shows, and all the things that they might do. Excuse me for a minute and get a drink here. I've had a cold this week, so thank you. And then making sure that those things are thought through so that the information can be shared and the parent can help to navigate that child to a high school diploma. The parent can also be appointed as an educational advocate. It's similar to hiring any other educational advocate. Many public schools have a way that the parent can assume that role so that the young person is still making their decisions and the parent serves the role of being an advocate or an advisor to that student. So there's a lot of different kinds of configurations that can be put into place. And then also if a young person goes to college or post-secondary education, in general, the parent will not have access to records. If they're a dependent for tax purposes, the parent may receive enrollment information, but possibly not grades or other kinds of information. But again, upon signing a release, the records can become available. It's very interesting. I've talked to a lot of people who, some colleges, because they worry about liability, a community college or an independent college will ask a parent who is paying the tuition or helping to finance the child's education or the young person's education to sign certain forms so that they can be contacted, and others go in a totally different direction. So it's really a good idea to be able to see which way the standard is and then make adjustments as needed. So at the current time, the Affordable Care Act allows young adults to stay on their parents' insurance until age 26. And I'm going to start from a premise that we all agree that it's great for young people to have insurance coverage. However, at age 18, the parent can no longer access their young adult's health records without permission from the young adult. And that's, again, a variable thing. Some insurance companies begin sending a notice, and some healthcare providers begin sending a notice to the young person at the age of 16 and a half and may give them the option of receiving, for instance, the results of their lab results, x-rays, blood tests independently, while others will continue to provide that to the parent who is carrying them on their insurance. So again, it can be extremely variable, and it's just a matter of keeping on top of it. But most parents cannot make appointments for their young adult or confirm whether or not the appointments are being kept. They're not the primary contact with the providers. There are things, and I'll talk about those in a minute, that can be done, but in general, those things change pretty quickly. So some of the things that can happen that can be very helpful is many organizations, healthcare organizations, use healthcare portals. And while some will give a password and an identity to the young person and tell the parent that they no longer have access, many young people that in our acquaintance are pretty willing to share that, as long as it's not sensitive information. But if it's regular kind of information, you're due for a physical, your blood test came back and we'd like you to have more vitamin D or something along those lines, they're pretty willing to share that information. And there's no form or no release required in order to be able to do that. Some parents will take on the role of an insurance advocate. I know with my son, he was absolutely not interested in calling and disputing any kinds of issues around the need for prior authorizations or whether a medication was on a formulary. We had one particular incident where he went to get a prescription filled, and the insurance company had changed the formulary, and they said, oh, you need a prior authorization. This was at the pharmacy. And he said, Mom, I was ready to walk away and say, I'm not taking those meds anymore. But then I thought, you're really good at this. So I decided to go ahead and give you a call. So, of course, I got on the phone and made that call, and it was straightened out very, very quickly. It was not a difficult thing to do, but to him, it was something he'd never done before and had no desire to learn right at that moment. So many times a young adult is very interested in having their parents still continue that role while they continue or they begin to make treatment decisions. Some young adults and youth are happy to hand over making appointments or renewing prescriptions. Some facilities will need a release on file in order for parents to do that, and some will not require that. But it's incredibly important to be able to figure out when that's needed so that regular appointments can be made and kept. And some will need assistance with finding an adult primary care, an adult primary specialist, or adult specialist, because again, that's often a lot of research and a lot of legwork, and it can seem really overwhelming for not very great rewards. What I have found that has been really workable for many, many families is to divide out these tasks and to say, okay, we need someone to make treatment decisions, We need someone to, talk to your insurance company if they say, well, gee, we're not too interested in covering that. We need someone to be able to make sure your medications are refilled if there's not an auto refill or it's a new prescription, and ask the young adult, what are you willing to do and what would you like someone to help you with? If it's a blanket question about whether you want to be in charge of your health care or not, more often than not, they're going to say, yep, I want to be in charge. But once you drill down and sort of outline what the tasks are, the conversation can be quite a lot different. So the first form I'm going to talk about is a healthcare proxy. And what I'm going to do is I'm going to go from the most, what I want to say, the easiest or the least restrictive kind of forms on up. And I'm not going to talk today about things like guardianship because that's really a legal concept. It's in our book. We do it in our training. But I'm going to begin with a healthcare proxy, which is probably one of the easiest things and to talk about, and everyone in the family should probably have a healthcare proxy. And a healthcare proxy is a legal document which appoints somebody to make healthcare decisions when you are not able to. So if you are in a car accident, if you had a bad reaction after some sort of surgery or something, you've said, well, this person can make my healthcare decisions. It can have special instructions. It can say this person can only make my healthcare decisions around primary care, around mental health, around certain kinds of healthcare, but not other kinds of healthcare. And it can also have limits, time limits for the period of 1 month, for the period of 6 months, whatever it may be. Most healthcare proxies require an alternate. So that if one person is unable to assume that task, you name a second person, and it can be revoked at any time, so that you can, even if you grant access for someone to make decisions, if you're not able to for a month, 2 weeks later, if you don't want to, you certainly can decide that you are going to change your mind and either appoint someone else or decide that you don't want a healthcare proxy right away, which is probably not what most health people would advise, but still it's a possible thing to do. Once you've got a healthcare proxy, it needs to be, a copy of it needs to be given to every one of the youth or young adult healthcare providers, including any crisis teams or crisis care that you might think that would be called upon over the next short amount of time. So the next thing to talk about a little bit is HIPAA. HIPAA is one of those laws, I guess, that seems to be interpreted fairly widely, fairly differently among different healthcare providers. I know people who have healthcare providers for medical needs, and they tend to be a lot more flexible about talking to parents and asking questions like, your child's in a crisis, did they eat earlier, have they taken their medications, do you know what precipitated this? Asking gathering all the information to be able to understand the picture better. Whereas in mental health and substance use, a lot of the providers seem to be a lot more narrow in what they feel that they can collect for information. Many of them even believe that they can't talk to the parents or the people around the young person, which is not necessarily true. So I pulled something out here from a national or federal HHS, and they have a guide on the HIPAA privacy rule. And this is one section of it, which basically asks a question. It's more of a Q&A, and it says, if I don't object, can my healthcare provider share or discuss my healthcare information with my family, friends, or others involved in my care or in the payment for my care? And the answer here is that your provider may ask permission. They may say, is it okay if I talk to your mom? This happens a lot with the elderly, where there'll be a person sitting there with an older patient, and someone might say, do you mind if I talk to your son or daughter? And they shake their head or nod their head. Something along those lines is perfectly okay. There doesn't have to be this incredibly rigorous conversation all the time around a simple conversation. People may decide it's a little bit more rigorous if the conversation gets more around treatment decisions or around other kinds of decisions, but around a simple exchange of information. It is really not as rigorous a law or a guideline as many times is interpreted to be. However, there are restrictions. The provider can only discuss the information that the person needs to know or that they might need to hear, like, did you eat that day? That kind of thing in case of an emergency. And it's really important to sort of have a conversation about what HIPAA allows for conversation and what it doesn't allow for conversations before people are in crisis and it gets to be more, touchy or emotional to talk about that. There are HIPAA release forms, so we've gone a step up from the healthcare proxy, and you can release the entire record under HIPAA, or you can release part of a record. You can revoke, again, the authorization at any time. And the purpose of the release is simply communication. In the case of your insurer, it's to resolve payment issues, and sometimes it's to allow somebody else to participate in treatment decisions. Again, to go back to an example with the elderly, a person who is older may be asked, do they want a surgery or do they want something that's more, involved healthcare? And they may ask, is it okay if your family member participate? The same thing can happen with a young adult. Let's talk about this medication, or let's talk about this form of treatment. Is it okay if your parent or someone who you would like to have as a sounding board participates in that conversation? There's nothing there that says that they cannot do that. So I want to move on to financial decision making, as it's a very big issue or big important piece of the young adult's life. So again, going from least restrictive to a more restrictive kind of bank account. Young people can set up a joint bank account, and that means that two people are on the account. Two people can view what's deposited and what's withdrawn from the account. Each person can, take action for the account, put money in, take money out. I have this kind of account with my son who is on SSI, and I'm his rep payee, and it's very convenient to be able to go in and look at the records in order when I have to make my yearly report on his SSI. And again, this is something that if there is a level of trust and good communication, it can work out really well. And then the parent can have a joint account with the young person, and that may be able, it's still in the young person's social security number, it's still in their name, and the parent may spot, for instance, if that young person is starting to withdraw a lot of money and won't have enough money to be able to make payments for gas, car insurance, other things that are required, and hopefully offer counsel. But there is nothing to stop the parent from allowing the young person to do what they wish with their own money. In a custodial account, which can also be set up with a bank account or with other kinds of accounts, it's set up for the benefit of somebody, and the responsible person, the custodian, has to sign off on each transaction. They have to agree to deposits, and they have to agree to withdrawals. And so it's a little bit more restrictive, and there are young people who the parent and the young person may agree that they need this kind of monitoring for maybe a short amount of time or maybe a certain amount of time until they learn how to budget a little bit more. These are two different kinds of accounts that can easily be set up. They don't require any particular kind of what do I want to say? Complicated kinds of setups or kinds of steps that need to be taken. So I want to talk a little bit now about meaningful decision making, which changes as young people get older. A person who is making decisions when they're 18 is certainly going to be thinking about them a lot differently than when they're 22 or 26 or 28. And so as they learn more and more how to make decisions, either whether it's about finances, about health care, about other kinds of things, that decision-making and the participation of the parent should change. The balance should move over towards the young person and away from the adult. In our family, I say a lot that advocacy is the family business. And my son says, I want to learn that advocacy. I want to learn to talk to my insurance company. I want to learn to stick up for myself. I want to learn to ask for the things I need. And so that was his goal from about 19 to until his mid-20s is he wanted to be doing more of that, but he didn't want to do all of it at the beginning. And so his decision-making and his actions coming out of his decision-making changed proportionately as he got older. And he also became more responsible, as young people can, for whatever might happen. A parent will obviously know a little bit more about what might happen if you do X, Y, and Z when their young person is maybe 18, and the young person has more experience under their belt when they're 22, and will have taken on a different level of responsibility. Again, that's sort of fluid. It would be nice if I'd drawn a graph here to sort of show that, but that is sort of something to be really thinking through. And many times when we talk about transition, we talk about it as if it happens at age 18, and of course that's not what happens in reality. So I want to talk lastly about how family organizations, family-run organizations, can help with all of this. We're very fortunate in my state to have a number of support groups for families who have young people who are transitioning. And we often take a chapter out of our legal guide, and the facilitator will talk about that, and there'll be a discussion, for instance, about financial decision-making, or, oh, my heavens, my child just turned 18, and they have a healthcare portal, and we'll have a discussion about that. So sometimes it's really structured, but the support is also not just for information sharing from us to parents, but it's also information sharing among parents about what works for them, and what they have found out in the community that works for them as well. And that's very, very important, because sometimes programs for young adults are few and far between. I mentioned training kind of tangentially here, but direct training for families and for people who work with young people about transition and about all of these kind of nuanced things, everything from insurance to life choices to education, all of those kinds of things is important to have, so that you know what is set in stone and what is negotiable. And then involving families in system change is probably the thing I wish you will all walk away with, thinking that that's an important thing to do, because we do have a system where an awful lot of things are set up in a way that is not conducive, as Melissa mentioned earlier, to involving families, and it's not as conducive to helping young adults move from the children's system to the adult system. And involving families in making those transitions is a really key way in order to be able to change the system to make it more young adult friendly. Along with that, to foster youth organizations in your community, such as Youth Move, who are looking a lot of times at the same issues from the point of view as a youth, so you have a lot of good conversation about the same issues from a variety of perspectives. Those are wonderful ways in which to both support the individual youth and family, but also to be able to make a more friendly environment as youth transition to become young adults. And along with that is to make sure that those things become how we do business. They're standard policies, they're standard practices for us all. They're not something where we feel like we're breaking ground with every new family and young adult, but something that we institutionalize so that things become the way that we hope they'll be, and much better for everybody who is working in the transition sphere. So I'm going to turn this over to Kathleen now, and thank you for listening.
Okay. Hi, folks. Thanks, Lisa, so much. I feel like you just gave us a billion pounds of information, and that's all really useful. I'm going to talk a little bit about kind of a systemic role for family orgs in both kind of the system level sense, but then also on the ground practical sense in terms of how a family org can help enhance other practices. And specifically, I'm going to talk about the RENEW process, which is an evidence-supported practice for transition age youth. So in New Hampshire, we have been really fortunate to have built and to be partners in building what we call the New Hampshire Children's Behavioral Health Collaborative. That provides kind of a state-level infrastructure for ensuring that the family and youth organizations are kind of full partners at the planning and policy tables. And so that really is a blessing in so many ways, because we have voice at kind of, the grant writing phase and the policy phase and introduction of legislation and you name it, and the families and youth have been at the table for the last 15, 20 years. And it is funded by philanthropic organizations at this point, and so the checkbook belongs outside of the system, which long-term is a challenge, but short-term really lets us get some things done and have some really free voice among all of the partners. So at the systems level, family-run organizations, and I know I'm looking at the attendance, I'm somewhat preaching to the choir, but we can really keep system partners informed of what we hear is and is not effective and efficient. We can assist our partners to get feedback and expertise from the families who are experiencing pilots and projects and services. We can help to design and implement evaluation measures, which is absolutely key. What is it we want to know? What is it we want to measure? And how do we know that what we're doing really is working? We can assist with planning for improvement of supports, and we can oftentimes be the primary mechanism to get information and messages and begin feedback loops with other families. So family-to-family education and support is a term frequently used by by us as family orgs. And some of the main benefits, we really can help reduce feelings of isolation and reduce the impact of stigma. Frequently, by the time families come to us, they're really expressing that they've kind of feel as though, whether true or not, they feel as though they've kind of overused or burnt a lot of their bridges and that they're very isolated. We can assist families to kind of navigate and figure out the multiple and complex systems with which they're faced, help them identify their strengths and resources, and encourage them to use their voice and expertise. We frequently act as a bridge between families and systems. So I want to talk a little bit on a practical level about some programming that we as a family organization help to develop and enhance. Renew is a program, national best practice around transition, and it was developed in the 90s by staff at the Institute on Disability. It was actually at the time the Institute on Emotional and Behavioral Disorders at Keene State. But its focus is on supporting every young person to design and pursue a plan for transition from school to adult life. We don't talk about transition in terms of transition to services because frequently for the young people we're supporting, there are not automatic services at 19 or at 20 and a half. The eligibility changes, all kinds of things change. So we talk about being as prepared as possible for adult life. Renew has had tremendously good outcomes, has really increased for young people who are served. High school completion goes up, employment goes up, post-secondary access comes up. All of those horrible data stats that we looked at for this kind of subpopulation, these kids do better with access to the Renew planning process. So Renew was doing pretty well. We were contracted initially by the IOD, the Institute on Disability, to talk about doing some parent surveys and some youth surveys. And one of the things that came out of those interviews, it was really in-person interviews, and I did most of them. One of the things that came out was, wow, we're doing really well, but we're doing even better in those instances when families are playing an active role in the planning process. And that was pretty clear. So then we talked about, okay, so how can we enhance the skills of the Renew facilitators in terms of engaging with families and in terms of kind of facilitating that delicate balance between the youth driving their process and the family feeling as though they can really support and rejoin the process. Frequently, by the time youth reach transition age, families are tired. They're burnt. They don't see that the next new thing is going to be the great solution. And what we saw was that as youth began to engage and began to make progress, families felt re-energized and much more able to come back to the table and bring additional resources. So the Federation in our state became a kind of integral system partner in the further development and enhancement of Renew. And we continue actually to sit at the leadership planning table, kind of what will the next iteration look like? How are we doing? Are we still kind of on top of our game in terms of family engagement as well? We've helped to redesign the outcome and satisfaction measures, so we're still pretty active. We have, sort of a logic model for where family fits in the phases of Renew. I'm not going to give, obviously, a full facilitation training today, but I think it's important that they have integrated into all of the materials kind of where a role might be for a family, and also have not limited to these kinds of places. So just a scenario to kind of round out the discussion today. This is one of those scenarios that's a little bit of a couple of people. We did have permission to share. We're going to talk about Mary, who was a junior at a large rural regional public high school. So we're talking rural and several communities served. Folks began to notice that her grades were dropping off pretty dramatically. She became at risk of not graduating. The family, for reasons of proximity and hours, were unable to access consistent mental health support. Juvenile justice system became kind of peripherally involved because of these low-level law-breaking behaviors. Single dad, 4 other kids. In our rural areas, people sometimes work 2 or 3 jobs seasonally. There's the tourist season, there's the logging season, there's kind of Christmas tree season, and so he would work these kind of variable hours. And one of the other children had very significant medical issues. So the school was really feeling like they had been totally unsuccessful in engaging Dad, not returning calls, not necessarily signing paperwork that came home, those kinds of things. Mary was referred to Renew and started kind of sharing her goals, dreams, challenges. It is, a very kind of step-by-step process. The facilitator was familiar with the Family Org because it was someone who had worked with us on those kind of policy and planning and training redesign pieces. And so that facilitator pretty quickly said, I wonder if we could get Dad some family peer support through the Family Org, if we could make a difference here. And so that facilitator did connect with Dad and said, hey, do you think you'd like to connect with someone who's kind of been there, done that? And that actually was accepted pretty readily. And so the parent peer support provider connected with the family. So they begin connecting. Dad really feels just isolated, overwhelmed, totally burnt out. Most of the focus that was left available after work and after, making sure meals and laundry and all of those things happened was really dedicated to this child who had significant medical needs. But Dad begins to share, begins to kind of come to the table in a peripheral way, not coming to every meeting that's held at the school, but beginning to connect with the facilitator and the peer support person, and expressed this connection between when Mary's tough time started and a family crisis that no one else really was aware of and that Mary hadn't fully shared, had kind of a little bit gone there, but not fully. The parent peer support person begins to do some real work with Dad, some educational stuff, some just listening, venting, helping weigh out some pros and cons. Mary winds up asking Dad to please come be part of the futures planning process, part of the Renew. So again, things begin to change, and this is not an overnight process, and we're never aiming for perfection. It's really that this Dad in particular began to see the kind of earnest, and he called them almost naive in a joking, but a kindly joking way, the efforts of the whole team. And he sees his daughter begin to really move toward her hopes and dreams. he begins to come back to the table. School is just ecstatic because he's answering the phone. They can reach him. He's not feeling as though every call from an outside provider and or from school is some kind of insurmountable mountain that he's going to be asked to climb. Mary's attendance and her credit recovery begin to really accelerate. She's on track. And in fact, she winds up completing her LNA through high school and becomes a medical provider. And I mean, it is just the kind of thing that can happen in a practical way. And I hear this story times 100 all the time when we think about incorporating some support from the family organization to the families directly who are really, facing multiple and complex challenges. And just that sense that there is someone who's there specifically for them and who is listening and help them to even sort out their own priorities and take some time with them is really tremendously powerful. And then to incorporate that into a kind of youth transition process and validate what that feels like for the family is extremely powerful also. And so just some takeaways that, we as a family will be there long after every provider is long gone, and will be pulled back in and pushed back out and pulled back in. And so we expect and deserve that there will be some kind of respect for the integral nature of that role in our children's lives, but also that we have a tremendous amount to offer. And just because at transition we may seem to be disengaged, tired, burnt out, doesn't mean that's the end of the line, and doesn't mean that we either don't want to be able to help or are not going to be able to help. I think it's just a matter of very calm and respectful approaches. And to understand that we really have value in terms of informing the system about what does and doesn't work and what kinds of approaches are particularly helpful. So final takeaways, we believe family involvement is critical to successful transition planning. Just as families of typically developing young people are integral to that process, the same holds true for us, that unique transitions require some extra and specialized level of planning expertise, and that family-run organizations are key stakeholders and we're good sources of family and young adult supports.
All right. Well, before we, I'm going to go ahead and advance us one more slide. I want to thank both Lisa Lambert and Kathleen Abate for giving us such a wonderful presentation. Kathleen, for your kind of on-the-ground example of how, an evidence-informed approach such as Renew can really create and facilitate opportunities for successful transition planning that really effectively and proactively engages families in that process. And Lisa, for you, really helping us identify some of those bigger picture issues around financing and healthcare and, decision making and all of those pieces that you have done to really create the guide that is so valuable. And I think want to remind folks that there's an opportunity to download the guide at the bottom of your screen under where it says Files for Download. You can download the guide that Lisa mentioned that her organization in Massachusetts developed. It's a wonderful, wonderful tool. It is Massachusetts specific. However, it has some really wonderful information in it that can be very valuable to use with families and with young people as you're transition planning. We want to take a few minutes to give you guys an opportunity to ask any questions or make any comments that you might have of Lisa or Kathleen or myself. I think we did at the very end, or towards the beginning of the presentation, there was a question. I see in the chat box there's a question around asking Lisa to talk a little bit about what ways they have found the guide to be most helpful in their work. Lisa, would you share that response with the full group? I know you typed it in the chat box.
Sure. Well, the guide is set up, as I sort of alluded to from the least restrictive, to the most restrictive sort of content areas. So there's a couple of places in the guide which I didn't talk about because I feel better if I have a lawyer at my side, for instance, talking about guardianship and some other things that are a little bit more, and different kinds of special trusts that are a little bit more important to know the legal details. And when we get questions on those, it's good to have sort of a legal person answering those questions. But for general conversation, we will sometimes take a section of the guide, and our parent groups will sometimes talk about them. For instance, let's say somebody has a 16-year-old, and they're talking about, well, gee, they're going to be in charge of their own finances in another, 2 years, or a 17-year-old, or somebody who's coming up towards that 18th birthday but isn't in charge of their finances yet. So there'll be a discussion about the different kinds of accounts. There'll be a discussion about different ways that there can be a separate savings, different strategies, and also the particular details on how you set that up. That will lead to discussions from parents who have already gone through that about what worked well for them. And for instance, maybe having more than one debit card, or maybe doing away with debit cards, or restricting how much can be withdrawn at a certain time, a single time, those kinds of conversations. So the overarching theme is discussed, some framework is given, and then the discussion will often get down to what works, what didn't work, what caused a lot of good conversation in my family, what everybody said, are you really going to do this way, kind of conversations in my family. So that gets to be a really great discussion. So that's one way we've used the guide. The other thing is we've been asked to come and do a presentation of the guide to a group of special educators, a different set of educators who are dealing with high schoolers. So different groups have asked to learn about that because they've been dealing more with transition age young people and wanted to know more particulars about things that they might not know as much about. We have not done the guide, but been requested to do it with school nurses who know a lot about healthcare decisions, but maybe not a lot about some of the other areas. So it's a great framework among a group of people who are working with young adults that have a similar kind of knowledge area and a similar kind of area in which they want to learn more about to have that conversation. So with parents and with others who are working with young adults.
Okay. Great. Thank you, Lisa. That was really, really helpful to kind of give some examples of how the guide could be used and how information from the guide could really be a conversation facilitator. We had a question come in earlier in the webinar, and the question was, how would one who is attempting to assist the youth overcome the ideology of the young adult that they know the world and how it works? The young adults with behavioral health are at such a risk. I become concerned about those who leave the family because they can at 18. Any suggestions?
Kathleen, you want
to? Kathleen or Lisa? I have thoughts, but I'm going to let you guys go.
I don't know. I'm kind of old school in terms of there's a social worky term we used to use about dignity of risk, and that people do to some extent have the dignity to the basic human right of making a poor decision. Now, the mom part of me and the realistic part of me says when it comes to our kids, when they're feeling really dysregulated and not okay, that can be a whole lot more dangerous than for some other young people. And so I think the ability to try to establish a really trusting dialogue and to allow for some of the less risky decisions, like I want to do something absolutely wild with my hair, I want to change what I'm doing for classes, so that the more actual decision making you can help the young person take charge over that are not dangerous and they don't feel constantly stymied or stopped, then when it comes to something big, I think there's a likelihood that your input might be more valuable to kind of restrain a little bit on the smaller things. But also, I think that it's part of the sooner you start transition planning and talk about chunking down those tasks, as Lisa described earlier, the better a sense of this is a helper and a support and not a controller. I think you get farther faster. Because I know, as Lisa said, my 17-year-old is not very interested in fighting with the insurance company. So we're already talking about what functions mom might be able to support with, as opposed to can mom take decision-making power. But I think that's really a critical distinction to make on a kid-by-kid, family-by-family basis, but to really support that autonomy in the places where it's really not that dangerous.
I would agree with that. I often say if my family were a game show, it would be called Let's Make a Deal. So we have these sort of conversations about, well, if I do this, will you do this? And usually my sons do that. They're the ones who like to negotiate everything. And to sort of follow up on what we've all been saying, if you can lay out for a young person that it's not all or nothing, that there are these different arenas to make decisions in, then it's a different conversation. I know healthcare is tricky. I sat with my son, for instance, when we were going to transition him from a pediatrician to an adult primary care doctor, and I said, okay, who would you like? We had a list of doctors in the health plan, and he wanted a man, and he wanted someone a little younger. And then I did the phone calls and made a few phone calls to find out their comfort level with mental health issues. And then he made the decision. So we chunked out, as Kathleen would say, different pieces of it. And I said, you're making the treatment decisions, what the doctor will say. That's your job. But is it okay if I help you with the family history part? And he was fine with that. So laying it out in a very clear way so that we're not talking about who's making the decisions, but we're talking about all of these things have to be done as we transition from pediatrician to adult primary care. What do you want to do? What don't you want to do? What would you like me to do? Went a lot better than all or nothing, So I think that it's been a good strategy. And I will say we've had this conversation with our youth move, and they can take it a million times farther than I can in terms of, piecing out the decisions, and they just run with it whenever we have that conversation.
Yeah. All right. Well, thank you. We had another question come in from Katie asking, given the new political climate, is there any knowledge of impact of new legislation such as the Affordable Health Care Act on things like health insurance coverage? I can speak a little bit to that, Katie. As of yesterday, what we knew, and things are ever changing in the climate, as everybody is aware of, but as of what our most recent kind of analysis of the American Health Care Act that is being proposed as replacement language for the Affordable Health Care Act says is that they would preserve the provision that would allow young adults up to the age of 26 to stay on their parents' health insurance plans. So as of what we know right now, that provision would be maintained, which is a good thing. And as of what we know as of yesterday, there is also language in there that maintains insurance provider, health insurance provider companies to be required to maintain the essential health benefits, which would include mental health and substance use treatment coverage as part of any plan that would be sold or provided to an employer for employees. So as of yesterday, those provisions were supposed to be maintained in the replacement proposal. So there would not be changes in that regard. However, there is also language in there that does speak to, as of 2020, there would be the requirement for essential health benefit coverage for individuals that are covered under Medicaid expansion would end as of 2020. So though that mental health and or substance use treatment coverage would no longer be available or no longer be required to be available as of 2020 for those individuals that are covered under Medicaid expansion, which is a large percentage of those individuals are individuals who have mental health and substance use disorders. So that would be something that would impact this population potentially. And Lisa, I don't know if you have any other thoughts you want to add to that, or Kathleen.
No. I think
No?
I think
Okay.
you covered it well. I think it's something we all need to keep a close eye on.
Yes, I would agree totally. I think it's definitely something that the climate's changing a lot, and so I think given that, it is definitely something that requires a lot of attention.
Melissa, Jane Walker just wrote that the New York Times update. Did you see that? You want to read that?
Yes. Jane commented, the New York Times update, President Trump agreed to the demands of conservative House Republicans to remove federal requirements that health insurance plans provide a basic set of benefits like maternity care, emergency services, mental health, and wellness visits, as he struggles to round up enough votes to pass a broad health care overhaul. So, again, as the climate continues to shift, those provisions may not be maintained in the language that is voted on. So I think we'll all have to kind of stay tuned for more information, because I think there's definitely a lot of conversation around the topic of the Affordable Care Act and the American Health Care Act right now. And that was just posted, Jane said, 27 minutes ago. So that's kind of the latest news we could possibly provide. So any other questions from folks in regards to transition planning, family involvement, and the benefits and opportunities of engaging family-run organizations as stakeholders in this work around transition planning from folks? Any final comments that Kathleen or Lisa you might want to make?
I just want to pitch again that your family-run organization is an incredible resource, and find out what they have to offer. They will certainly be able to tell you, and it's something that to do sooner rather than later.
Absolutely. I think to piggyback on that, Lisa, and that's such a great point, that there's a family-run organization in almost every state throughout the country. So if you're not aware of the family-run organization in your state, please reach out to us at FREDLA. You can contact us at info@fredla.org, or you can comment in the chat box that you'd like us to follow up with you, and we would be happy to connect you with who the family-run organization is in your community, region, or state. There's many statewide organizations, and there's also many local community-based organizations. So we would be more than happy to facilitate you getting you connected to that, so that you could connect with who those folks are and find out how to reach them. We can give you their contact information and facilitate making that bridge. So, and as Lisa said, they're a wonderful, wonderful source of resources and information. Family-run organizations, you know, can be a place that you can let families and youth know about for support and education and resources and peer-to-peer connections. They're also an incredible resource as it relates to systems and to providers, as far as helping you, hear from families and youth that are being served about what works and what doesn't, as well as helping to support systems and service providers in your efforts of partnering with parents and youth and navigating that delicate kind of balance around transition that needs to happen as you kind of sort through that. As a parent who, is continuing to kind of go through transition with my oldest son who has some significant mental health issues, it really is a very delicate dance between yourself as a family, parent, caregiver, and your young person. And there's, oftentimes no right or wrong answer, and you're kind of figuring out that dance as you're going. And, you do your best not to step on each other's toes and not to crowd each other and not to, disrespect each other's, space, but sometimes you bump into each other and you do step on each other's toes and you do crowd one another, and sometimes you struggle for who's leading the dance and who's kind of following. But, I think as long as you approach it from a place of we're all learning together and we're all figuring it out and we're going to make mistakes, but we're going to grow in that process and we're going to, learn and we're going to develop a healthier, stronger, better relationship, you do figure it out. And it really is, has been for me, an incredible growing experience and an incredible learning experience. And it's such an opportunity to watch my son kind of come into his own. So, I think engaging your family-run organizations and also really approaching families, as Kathleen so wonderfully kind of articulated in her presentation, from a place of, meet the family where they are and really try to get to know if they're not engaging in the way you think that they should. There might be a lot going on in that family's life that is playing a role in why they're not engaging or why they're struggling to play the role that maybe we think they should play. And so really reaching out and really trying to figure out how can we partner with them and how can we reach them in a way that feels good to them and feels supportive to them. And, because most families, they want their children to be successful, they want their kids to succeed, and they want to be a positive resource for their kids as they grow into young adults and into adulthood. And so, kind of coming at it from that perspective, knowing that and presuming that, it's really about that piece of how do we partner with each family that we're working with in an individualized way that works for them and respects who they are as people and their culture as to who they are as a family, as a family unit. So, well, I think I want to thank everybody for being on the call with us today and for sharing so much good information. There was a lot of wonderful dialogue going on in the chat box. And again, if anyone needs any more information or wants any more information, reach out to Fredla. Also want to remind folks that Fredla has a Children's Mental Health Awareness Week campaign that it's kicked off, titled Family-Run Organizations, Supporting Families, Improving Lives. And for full details and to download a template, you can click on the link on your slide that will take you to our website, and there's a flyer there that has all the information for you. We are asking families and youth to fill out a template and take photos indicating how their family-run organizations supported them. And so for all the details, use that link. We're asking that photos come in by April 7th so that we can turn them into a wonderful slideshow that we'll disseminate broadly with everyone during the week of Children's Mental Health Awareness Week in May, so the first week of May. So please check that out on our website. We would love to get lots and lots of pictures of families and youth with their templates telling us how family-run organizations supported them and their families. So we will not be having a learning community in April. We're taking April off. We have a big meeting in April. So we will be seeing you the fourth Thursday of May, May 23rd, where we'll join you back for our next learning community. So thank you all for participating and joining us today, and thank you, Kathleen and Lisa, for being our guest presenters today.